Good afternoon and welcome to this afternoon's virtual meeting. The Office of Early Childhood is hosting the Department of Public Health to discuss COVID-19 vaccines. We're really grateful for the time that you've given us this afternoon to help us answer some questions that you might have and to discuss next steps with the rollout for Group 1B. We're using Teams Live this afternoon, and if you are interested in accessing subtitles for today's presentation, you can click in the bottom right-hand corner of your screen. There's a small icon that says CC. If you click on that icon, you can select subtitles, turn your subtitles on, and select Spanish. In the future, we'll be able to offer subtitles in other languages as well. We thank you very much for your engagement this afternoon. If you have any questions about accessing subtitles throughout the discussion, please send us a question in the Q&A feature in Teams Live. The Q&A feature will also be available for the entirety of today's afternoon meeting, and we'll be answering many of your questions live this afternoon. Thank you very much again for your engagement, and I'd like to introduce Commissioner Beth, who will be introducing our colleagues at the Department of Public Health. Commissioner Bai.
Thank you, Rachel, and welcome to early childhood providers who are here. We're so grateful to your service, for your service to children and families. We have more than 500 child care professionals on the call. We're really grateful to Krista Veneziano for being here today from the Department of Public Health. She is an epidemiologist, and before COVID, a lot of people might not have even known what epidemiologists did, but it's a word of the year. They've been so important, and DPH has been such an important partner in this work. I wanted to say a few words before Krista gets started. Krista gets started. Sorry about that, Krista. This work on vaccines is really being led by the Department of Public Health and the Office of the Governor on vaccines. That is where the lead is coming for vaccines, and there are also committees with representatives from the community and representatives from healthcare that are working with Department of Public Health and the Office of the Governor to make decisions about vaccines. Our job at OEC is what we're working to do is to assure that you have the info that you need from Department of Public Health, and there's a lot of community-based efforts about information, but we know based on the number of questions we've been getting that it was time for us to put something on for providers to give you a chance to ask your questions and to provide some baseline information for you all. I will say, and you'll hear this in the presentation, that there is information at the Department of Public Health website and 211 Child Care, 211 Info Line, not 211 Child Care, but 211 Child Care, 211 Info Line has also been a source of information, I know, where some of you have been turning, and they're doing a good job. As we begin the webinar today, and I think going forward for the next couple of months, patience has to be the word of the day. Patience for our Connecticut community as we work through the different phases of this vaccine. This is a really hopeful time after almost a year of this terrible virus, awful losses that some of you have experienced, and other impacts of this. And the vaccines bring us hope. You probably all know that early childhood educators are considered frontline essential workers. They are in phase 1B, which is a broad category because there really are a lot of frontline essential workers like childcare providers who have been supporting our communities at this really difficult time and who do interface with the public regularly, putting them at higher risk. We're currently in phase B, but phase B is being staged. And the first stage is really for 75 and older that are getting vaccinated right now. And then it will be people who are 65 to 75. And I think that, you know, some of these decisions are difficult ones that are going on, but listening to the committee meetings, and those are open to the public, it's really clear that the committee and the Department of Public Health and the governor are focused on saving as many lives as possible. And in many cases, people 65 and 75 and older may not have the same exposure of risk that frontline workers have, but they're at a higher risk of dying from the virus. And so that's what was driving this first phase of decision making. It's really important that until we have mass vaccination, that we keep doing the mitigating factors that we've been employing in childcare programs and early childhood settings that reduce community spread. And I know Krista's going to talk about some of those, and we've been talking about it on webinars at OEC for the past 10 months. Hand washing, wearing a mask, screening, cleaning, all those things that you've been doing to help keep your community safe at your childcare center and in your town. What's really going to dictate how fast people get vaccinated is the federal supply. Connecticut is getting a supply every week and working to get every ounce of that supply out and doing very well. I know Connecticut's in the top 5 states in the country in terms of per capita vaccination. So as I've said, there's a committee process, and I think it's important to note that that committee is also really looking at issues of equity, making sure that those communities that have been most impacted by this virus are receiving consideration for getting the vaccine in a timely manner. So I'm going to turn it over to Krista, who's going to present for about 10 to 15 minutes, and then she's going to take questions. We've really saved most of the time for questions. I want to just close by thanking you again for your service to the state of Connecticut, to the children and families. We know you're anxious to get the vaccine, and I think the governor and everyone else in the state is also anxious that you get the vaccine as soon as possible. And that's why we wanted to bring you this information, so you would have context for when that's coming your way and what are the next steps and how do you register your staff, etc. So Krista, thanks again for coming. It's really nice to see you.
Thank you very much for having me. Are my slides showing? Just making sure. Yes, perfect. All right, thank you everybody so much for taking the time out of your very busy schedules to be here to listen to me. I'm hoping to be able to provide you with some information that is helpful and useful to you. And hopefully if you have extra questions, I'm happy to try and answer those. If I can't answer a question, I'm sure we'll write it down and we'll be able to get back to you once I am able to get the answer for you. So I want to talk to you first about safety and effectiveness of the vaccine. I know there's some people out there that are worried since it's a brand new vaccine. Should they get it? Maybe I'll wait, maybe I won't, I don't know. But I wanted to let you know kind of the process behind the vaccine being produced. So the manufacturers, they came up with their vaccine. They went through very strict safety and effectiveness clinical trials. They included 40,000 plus volunteers who received the vaccine during the trials. Those individuals would report back to the scientists, letting them know if they had any side effects, how they were feeling, and they would do that for both the first and the second dose. At that point, I guess when they saw that they had some good results, they applied to the FDA, the Food and Drug Administration, for an emergency use authorization. We call it an EUA for short. That means that the company, the manufacturer, has been working on it. They're going through all the paperwork and the process for the official approval, but this emergency use authorization is to allow the company to be able to actually produce additional supply and roll out for use for the states and the public because the FDA finds that it's safe enough for them to do. They will continue and apply for that official, formal, I guess, regular approval, but the FDA wouldn't have said it's okay to use for an EUA if it wasn't safe. So I just wanted to let you know, hopefully that will reduce anybody's hesitancy to receive the vaccine. Now, if you ever have any worries or concerns, I would suggest you speak to your medical care provider, because I'm not a doctor, so you definitely want to talk to your medical provider. Now, as the commissioner mentioned, we do have vaccine coming into Connecticut. We have about 44,000 to 45,000 first doses coming in weekly. So as they come in, they are dispersed out throughout the state to our vaccine providers for them to be able to get it into people's arms. We are prepared to administer additional doses if that number increases, and that's what we all keep our fingers crossed, like, oh, well, we're doing so well, maybe they'll give us more. So we're hoping for that. Now, I know people have heard from others, like my sister's friend's aunt's niece received the vaccine out of order. That might have happened, but last Thursday, I believe the governor, went on to his press conference and said, this is the way it's going to be. We are going to do, I think my next slide, nope. We're going to do this tiered approach, and our first and foremost group that we want to vaccinate are our 75 and plus. We've already done the phase 1A healthcare providers. So now we want to do our 75 and older individuals. These are the individuals that are the ones that are dying the most. So he wanted to be, to make sure they receive that vaccine. Some people might have gotten lost in the shuffle over the first few weeks and, got their shot, out of order, but it has not been rampant. It has not been tons and tons of people where it would affect this first doses for everybody else. But he's made it quite clear, like, this is going to stop. If you have an appointment, he wants you to cancel it. And also at the vaccine sites, they will check and say, okay, it's not your turn, and they will turn people away. So I just wanted to let you know about that as well. Now, some reasons why you should get the vaccine. It'll help you from getting COVID-19, and that's what we want. We don't want anyone getting this. And if you do happen to get the COVID-19 after you get vaccinated, it may help you from getting seriously ill. So it'll prevent you from getting really sick. You may not even realize you have COVID. And it will help protect the people around you. So if all of us get the vaccine and there are some people that for some reason they cannot get the vaccine, it will help what we call herd immunity. So if most of the people have it, the ones that can't, it'll help protect them as well. Now, if you do get the vaccine, or while you're waiting to get the vaccine, we still need to continue with our other safety measures. I know the commissioner mentioned this as well. And I know daycare or childcare providers, all the different versions that you have, you are always washing their hands and covering their coughs and sneezes and disinfecting everything. So you guys probably have that covered already. But, it's the social distancing, the mask wearing, and then, more adults like avoiding crowds, try not to be in poorly ventilated spaces. So that's what you still will want to do even after you get the vaccine. So the commissioner also mentioned that we're doing a tiered vaccine rollout. So as the governor had said, we're continuing to schedule individuals 75 years of age and older. And then we will likely at the early February or so, we will then move on to individuals who are 65 to 74 years of age, because again, they are also the ones that are dying the most from COVID-19. And then hopefully late February, early March, we will move into the phase where the frontline and essential workers fall, which is where education and childcare falls, which is all of you. Now, just to recap, the frontline essential workers are those who are in the select sectors and also are at risk for work-related COVID because Their duties must be performed on site, so less than 6 feet proximity to others, to their public or the co-workers. So somebody like me, who's working very hard on this, I can work from home. I've been working from home for quite some time. I don't need to get the vaccine right away. Even I just don't. If I can work from home, I'm good. I don't need to get the vaccine. Others, like you, who are dealing with the public so much, and other like grocery stores, and you'll see the list in a second, you'll see like, yeah, they have a lot of communication and interaction with the public, so they would be the ones that need to get the vaccine. And then also individuals with comorbidities that put them at risk for severe COVID. That's still being worked on. A lot of this stuff is still being worked on. And then congregate settings, they're going to be phased in throughout phase 1B. That's where people live together in a congregate setting, as the title says, right? And they would be at risk of spreading it throughout the whole congregate care setting. Now, updates on vaccine rollout. Those will come from the governor, and then hopefully they'll be passed down to you through OEC and through our website. So the governor will announce updates during his press conferences, and then typically there's an accompanying press release, and I put the press release link in my presentation. And then also it will be updated on our CT COVID-19 vaccine phases and eligibility website. I'm asking you to bookmark this webpage because it will be updated with the most up-to-date information. So if something the governor changes, it should be up on our website very soon after. That way it'll give you more information as quick as we can give it to you. And of course we would share it with OEC so it can be shared out with you as well. Now, our essential workforce sectors. I listed all the ones that our allocation subcommittee decided upon. I highlighted in red there the education childcare workers. That's you. So I want to make sure you see that you're in that list. So I just want to make sure you knew that. So the process for vaccine registration. Currently, the process for the registration and scheduling a vaccine can be found on that phases website. If you go to that website, you'll see pretty much my few slides ago, you'll see like the different tiered approach. And then you can only really click on the individual 75 years of age and older, because that's all that we're scheduling right now. This on my slide is also some scheduling options. There's something called VAMS, our Vaccine Administration Management System. And then individuals 75 and older can also schedule directly through participating providers. And you'll see on the screen, it says UConn Health, Hartford, Yale, Walgreens. So they can click on those links and see if there are clinics close by to them, and they can deal directly with the providers instead of going through VAMS. I don't know if you've heard about VAMS. Sometimes it can be a little clunky and difficult to use. There might be there are a lot of steps to it. This process, as of 2 hours ago, may be changing by the time we get to your sector or for you to actually sign up. And so that necessitated me going back to this presentation and modifying it. I'm still going to review some VAMS material with you, but I'm just letting you know it may change by the time it's your turn. So don't hate me for not having the exact answer. It's just really being worked on as we speak. So, and hopefully that new system, if a new system comes on board, it will most likely be a little bit easier than VAMS. But let me go over VAMS with you. So in early December, the Office of Early Childhood was kind enough to provide us with a list of businesses, employer contacts, emails, phone numbers. We have those in a file off to the side to be ready to be uploaded, and you all sent a link to be able to to complete a submission form. So then we can upload that form, upload that information into VAMS. If you were licensed after December 1st or a youth camp that wasn't operating at the time, I'm going to ask you to hold off because of this changing process right now. There's no real way to get you into the system just yet, but you will be able to get in the system. Please don't think we're going to forget about you, I promise. So if this is the way we go, if we continue with VAMS, providers will receive an email from DPH asking you to complete the form. What I'd ask you to do is to complete the information, and then you should receive a confirmation email after you submit your information. If we continue with VAMS, the individuals that were not on our list, so you don't receive that email, you're like, where's my email? There will be a link on the website for you to be able to go click on it and fill out the information. So I'm saving you a little bit of a step from waiting for the email to come in. Now, if we continue with the VAMS system, your submitted information will be uploaded into VAMS when your organization meets the requirements to be vaccinated. So as long as we're in that right phase, you'll be uploaded. Now, while you wait, we ask that you roster your employees, their first name, last name, email, and I know the OEC has more information on this for you, so stay tuned for that. It's great stuff. Now, once your information is uploaded into VAMS, if we use the system, you'll receive a registration email from the CDC no reply email that you see up on your screen. If you click on the link within the email, this will allow you to create your account in VAMS. It's going to ask you for some additional information. And then when asked via email, you will then upload your roster. Then the employees that you have uploaded will receive an email from VAMS. They'll be able to create their account and schedule an appointment to be vaccinated, which is what we're trying to get to, right? So quick recap, that's a lot of like different emails come flying, right? So if we continue to use VAMS, there's 4 emails to be on the lookout for. DPH requesting information from you, confirmation that that information was received, register in VAMS to create your account through the link, the no reply email link, and then upload your roster of employees. Now the timelines on these emails. First email, we're still being established because now we're not even sure we're going to use VAMS. So I'm hoping we will still be able to use all your contact information and say, this is the system that we're using. This is how you start your process. I'm hoping that's the way that we go. That's what I'm going to push for. Your second email, if we use this, will come almost immediately after you submit your information. You'll get it right up on the screen, or the email will come saying, yep, we received it, you're good. Third email, you should receive about 24 to 48 hours after the information is uploaded into VAMS. It needs to go through its process, maybe sooner, my fingers would be crossed. And then upload your roster employee when the governor makes the decision to vaccinate the frontline essential workers. Now, within VAMS, there's somebody called an employer coordinator. That would be somebody on your staff who is responsible for developing and coordinating the upload of the roster into VAMS. Only one employer coordinator should be assigned per business entity. So if you have more than one location, I can't remember a daycare that has a lot of locations, we'd ask that you just put all employees on one roster. It will save you a headache of creating multiple accounts. The employee coordinator can only be the employee coordinator for one business. So it makes it easier if everybody's just on one roster and you upload it. Only staff should be included in the roster. You don't want to include household members. When you register in VAMS, you are saying, I can't remember the exact wording, but it says, under penalty of law, I promise that this is the right information and I'm not going against what the governor says, that kind of thing. So remember, the vaccine is for workers who are identified in the sectors, and they are the ones at risk from COVID because of their work, because they have to be on site in proximity, less than 6 feet, of coworkers of the public. Now, if you wanted to look at the VAMS Employer Coordinator User Manual, I put a little link in there. It's a very long website address, so I didn't want to put the whole thing. It's very long and ugly looking. So that was my presentation. If after this call you have other questions, other concerns, you can always email the dph.covid19@ct.gov email, and that can get routed to the most appropriate person to be able to answer your questions. So that is my presentation. I will stop sharing my screen now. Yes?
Sure. Thanks, Krista. That was helpful. I think one thing we've all learned with COVID is the only thing certain is change. It's a pandemic, which means that things change. And I know the VAMS, a lot of programs have begun that process and are waiting for the appropriate time. But if it is changed, the whole goal is that what's been developed already will be usable again. And the idea is it's being changed because it is sort of cumbersome, so they're trying to make it easier. So when it comes time for frontline essential workers after 65 and over, they would like to have the system in better shape for making appointments and for helping make sure that they cover everyone. I know there are a bunch of questions, and that was the idea, to answer a lot of those questions. Rachel, are you summarizing those, or is someone else?
I will be summarizing them. So I think we're ready to begin. What we have clearly have a slide up here, but both Krista and Commissioner Bai are here to answer questions. So one of the main questions we've heard a few times, so we'd like to just reiterate, when do we anticipate folks in 1B in the child care category having access to the vaccine?
Sorry, I had to unmute myself. We're hoping that we'll have some decisions made by the end of February, early March. I don't know what the governor and the committee are going to recommend, or the committee recommend to the governor. There were a lot of individuals or a lot of sectors within that, or a lot of individual categories within the sector. I don't know if they plan to tier those or just say anybody in this sector or categories can just go. So I'm not really sure, but I'm hoping we have that decision sometime late March, late February, early March.
Krista, I would just want to add in that from what's been available, basically the way early childhood is listed is it says teachers and early childhood professionals. So it seems as though early childhood and teachers are in the same band. And you can imagine what's going on is everyone who's working directly with the public is concerned and wants to get a vaccine as soon as possible. The governor has heard this from early childhood, as has Commissioner Gifford, and they've been very supportive, understanding that early childhood providers have been on the front lines and are working closely with children, and it's not always easy to maintain distance, etc. But that's why I said patience is really important. It's gonna be longer than any of us would like, and we have a significant push from frontline essential workers saying this is important. But I think it is important because I saw questions in the chat about, are we in with teachers? And the way it's structured now, it says teachers and early childhood providers. So I just wanted to provide at least that information.
Right. May I add one other thing? I forgot to mention this. I had it on my brain to mention, then I forgot, so I apologize. But we will be opening it, or the next tier is 65 to 74. If anybody that works in your daycare is within that age range, they don't have to wait for you to upload their name in your business, through your business. They can go and register as an individual and schedule and receive that vaccine. And that's okay. That's absolutely okay. And I would encourage it. Why not, right? So just keep that in mind too. I don't know the age range of everybody working at daycares, but I know it's broad, so I want you all to be aware of that as well.
Thanks, Krista. We did get some questions about the order of operations, if you fell into a category where you would be eligible before early childhood educators came up. So that helps answer that question. And thank you, Commissioner, also for speaking to the parity between early childhood educators and K-12 educators, as we did have a number of questions about that. So we did have some questions from folks about their roster and who qualifies to be on their roster. So we've had some questions about front desk staff, maintenance staff, substitutes, school volunteers, teaching assistants, all the different really, really important folks that make our childcare operations tick. How should employers be thinking about the roster that they submit for vaccine eligibility?
So they should be thinking about who works in their facility. It's impossible for me or the committee to know all the different job titles you have within your facility. Just like state employees, I'm working on those as well, and I don't know what every agency does. I mean, I may have kind of an idea, but I don't know what they do and where they go. So it's really important that you look at the definition that I've provided of frontline essential workers and look deep inside and really make a determination like, okay, yes, you're always in front of people, you're working, or you know what, you're in the, you're working from home doing paperwork and whatnot. So it's really something that we would rely on you to make that determination.
Great, thank you. So we have a question about, and I think we may have to go back to the screen that you shared, Krista, about the order of operations with VAMS, and maybe knowing that VAMS, we may be experiencing some changes. We do have a number of questions that say, I have not received anything, what do I do? Or how do we check our information once we think we've submitted it to VAMS? So if you could maybe speak to those, and if you think we need to display your slides as well, we can do that.
Sure. I don't think any daycare providers that I know of have been uploaded into VAMS, so you wouldn't have received anything just yet. When you receive the email to provide information, it will then be uploaded into VAMS. The absolute day that it's uploaded into VAMS, I'm not sure of, but soon after that, you will receive the no reply email from CDC.
Krista, can I just update
Sure.
one part of what you're saying, which
Yep.
is there may be childcare centers that are affiliated with hospitals or other nursing homes. And so I'm just saying there may actually be some who received it because of the employer of those childcare workers. But just so we don't get 100, Q&As
Right.
saying, wait, I got it. It's likely because of the type of employer that you have more than childcare. And if it's different than that, y'all can let us know in the Q&A. But I'm sorry, I just want to make that one clarification where there may have been some based on the ultimate employer.
Oh, that's interesting. Yeah, that could be a reason as well. Thank you. So when that portion of the phase opens up, you will have some type of communication from either OEC or through the email system that I went through a few moments ago. And if you don't receive anything, there will be a website that you can go to and then enter in your information. As far as I understand, that's how it's going to work. So there'll be a lot of avenues to ensure that you get into whichever system you are we're using at the time. And I'm telling you, check that phases website because that is where you'll be able to click on a link and it'll explain more as we get more information.
Okay, great. Thank you. So we have a question again about who falls into 1B, and I think you did a great job explaining that, but we have a number of family childcare providers in today's call. And so there are some questions about family members in the household and whether they will be eligible for the vaccine when childcare providers are eligible.
As far as I understand, no, they will not.
Great, thank you. So we have a question which I actually think is best suited for you, Krista, but perhaps Commissioner Bai, you might have some thoughts too. Will the vaccine be mandatory for early care and education providers, child care providers broadly read?
As far as I understand, the governor is not making this vaccine mandatory for anybody, especially with it being under an EUA. It's not mandatory. I know the military in Connecticut, the National Guard, it's not mandatory for them because of it being under an EUA. So I think unless Commissioner Bai has something else to say. No, okay.
All right, so we have a few more questions to cover, and a number of the questions we have are around the process and next steps, and we did prepare some step-by-steps to talk about our background checks information system and how you can use that system to actually prepare your employee roster. So I think we have time to review that, Commissioner, if that makes sense to you. But
sure, I just see, there's one clarification I'd like to have maybe Mike Curley make or Deb Fliss, which is, I think it would be helpful if providers heard how DPH got the list from OEC and who was in it, because there are questions about camps, questions about before and after school programs. So I know, Mike, you were part of working on the list that went over to DPH to the employers. Can you just tell folks how that worked and who we sent over?
Sure. So the OEC did get a request from the Department of Public Health for a list of our child care providers, and we did provide that list of all the employers, and that list included licensed child care centers, licensed family child care homes, licensed group child care homes, licensed exempt center-based care for kids providers, and also currently operating youth camps. So all of those employers were provided to DPH to be enrolled in the VAM system.
Mike, that's helpful. Can you just clarify that, and I know because some of it's the legal definition, but after school programs are included in the definition of child care programs, correct?
Correct. An after school program, unless it were run by a municipality or a school, many after school programs are licensed as child care centers.
And if it's an after school program or an early childhood program operated by a school, then that school is their employer and they will be submitting the list, as schools are separate, if it's a municipally run program. So there may be ways, and feel free to write in the Q&A, or groups that you think might be left out. I think our goal is to include everyone who we have oversight over at OEC. State Department of Ed is working with municipalities and school boards to get everyone who they have purview over. I think it helps to give it context to think of, and Krista, you said this, but this is about the employer. We're trying to identify employers of child care providers. The employers identify who works for them, and Krista was clear, it's everyone who works in that front-facing frontline worker business, because they all have contact with the public. And then that employer supplies Department of Public Health with a list of employees, and then from there, the employees receive notice about the vaccines. So it's complicated, but it's meant to go through the employer. And if you as an employer have questions, you can reach out to that email at DPH. It's really important that DPH runs this, that with such a complicated system, there needs to be an agency in charge. And so we're at OEC really, that's why Krista's here today. We're really trying to keep that nexus with DPH, so there's not confusion in the system. And we're happy to sponsor another Q&A in 3 weeks as it gets closer and as the committee and the governor make additional decisions. But probably the most important decision is how many vaccines does Connecticut get from the federal government? We were hoping to get an extra 50,000 this week, for example, that were canceled. We were expecting to get additional ones because we've been so effective and not wasting vaccine and getting them out, and that hasn't happened. And now there's a change in administration. So I'll say it again, the only constant is change in this pandemic, but we're trying, the governor and Commissioner Gifford are trying to get the state set up that we can get these out as fast as they come, but we can only get them out as fast as they come to us, which is why the patience is important, and just we're all trying to think about the whole community while we're considering early childhood ed. So Mike, that was helpful. And Rachel, if there was nothing else in terms of, I know there are other questions, but if you think that covers most of the theme of the questions, we'll turn it back to Mike, because there is an opportunity sort of to, I'm not supposed to say, I should say, I don't want to say get two birds with the stone thing, because that's not very nice, but there is a way to take care of two things at once. With the background checks work we're doing, we're working to get staff rosters from every program uploaded at OEC so we can let you know who needs a background check when. At the same time, we're trying to help, you're trying to put together a staff roster for Department of Public Health. And I know our lead attorney, Mike Curley, has been working to make sure these two things work together so that if you have a staff roster done for your background checks, that can be easily transferred to be used for vaccines. So I'm going to turn it to him. Excuse me.
Thanks very much, Commissioner. And that's right. So basically what I'm going to talk about is something that we've done to try to make this process easier for childcare employers. So first, I just want to be clear about who this does apply to and who this does not apply to. So this process that I'm going to walk through does not apply to family childcare providers at this time. And the reason for that is that family childcare providers have not been added to our background check system yet. We will be doing that soon. So family childcare providers that are listening, you should look out for an email in the future when we will invite you to access our background check system. But for now, since you're not in that system yet, this would not apply to family childcare providers. Who this is for employers of childcare centers, group childcare homes, license exempt, center-based care for kids facilities. And it's really for the employers, so the director of the program or the operator of the program, not the individual staff members. And again, as Commissioner Bai mentioned, this is really about what you can do now to prepare your staff roster so that when the time comes to upload it and provide that roster to DPH, you'll have it ready to do that. As she said, there's really two things that are needed here. The OEC needs a list of your staff for background checks purposes, and DPH needs the list of your staff members for the COVID-19 vaccine. So this is a way you can make sure that you have the roster prepared, you have all of your staff on it, and then when the time comes to provide it to DPH, we've added a feature in our background check system so you can download it in the correct format. So I'm going to walk through 5 steps to do this. And the first step is really just to confirm that you're in our background check system. If you are one of those childcare providers, a center, a group home, or a license exempt facility that gets care for kids. So we've sent out invitations to all of those provider types to invite you to register in the system. But if you haven't done that yet, it's really important that you do that if you are one of those types of facilities. So there is a link on our vaccine section of the website, of the OEC website, that we emailed out to all providers last week. And there's a link called Learn More about how to log in or create a BCIS account. And you can click that link, and that will allow you to register if you haven't, or to log in to update your staff roster. So that's really the first thing to do is to make sure you've done that step. And if you haven't done that step, to register your account and add all your staff into that system. So if you have already registered, maybe, you know, we started sending these invitations in 2019. So you may have registered a while back and started adding your staff. But it's important to log in now to make sure that you have all of your staff listed and that that list is current.
Mike, is this available on the website, something about how to access BCIS? And if not, can we make that accessible on the website somewhere that's easy to find?
Yes, it is on the website, on the vaccine section of the website.
Great.
So it's really in two places on the OEC website. There's a section about BCIS, explaining BCIS, and that has the links to register and to log in. And then on our vaccine section, we also have a link that takes you to the BCIS section. And I see that both of those links have been posted in the chat of this webinar, so you can look in the chat to find those links. So as Krista mentioned, the original plan is to use the VAM system, and we have added a feature to our background check system that lets you download your staff roster in the correct format to be uploaded into VAMS, and that's a CSV file, basically an Excel spreadsheet or a spreadsheet. So at this point, because we haven't reached the time for childcare providers to begin receiving the vaccine, as Krista explained, once you've confirmed that your roster is complete in BCIS, at that point you would just wait until it's announced that it's time for childcare providers to begin vaccinations, which, as Krista mentioned, is estimated for late February, early March. When that time comes and it's time to download your roster, as I mentioned, we've added a link to let you download it in the correct format for VAMS. And if it turns out that the VAM system is not going to be used, we'll update and provide more information on that. And there are instructions, if you go to that vaccine section of the website, there are instructions that walk you through how to add an email address for each staff member, and how to download the roster in the format for VAMS. And I just want to reiterate that point, that it is important to make sure you have an email address listed for each staff member. So that's important both for BCIS and also for providing your list to VAMS. Each staff member has to have their individual email address listed on the roster.
Thanks, Mike.
Yep. And so then the last step is uploading that roster after you download it. And there are instructions on how to do that and how to use the VAM system. And we'll make those available as we get closer to that time as well.
That's really helpful. And I do recommend that you take advantage of this chance to work on both, so you can have a good way to keep track of what staff need background checks with the new federal rules, and also have a ready list for this. I just want to reiterate one thing, because I see a lot of comments in the chat about, which we're seeing across the state of Connecticut, about concerns that somehow childcare has been pushed further back in the line. It's just not accurate. We're just all going to have to be patient The goal is, as I've said, the focus is going to be on people who are likely to pass away because they get this virus. That is people 65 and older. There are no right choices here. I think I've been saying this on webinars throughout COVID. There's sometimes bad choices and worse choices. Unfortunately, we don't have enough vaccine. We are grateful that there is a vaccine and it's coming. We all wish it was coming faster, but I think we need to, be as patient as we can be and understand that the governor has kept early childhood educators in frontline essential workers, along with teachers and other frontline essential workers. Every one of those groups is waiting till people over 65 get vaccinated. And we will all continue to advocate for early childhood educators. You have been on the front lines. You have been putting yourselves at risk. I know there are many people on this call who've had COVID or who've had staff members who've had COVID or family members. It's a very difficult situation. And we're going to keep doing those mitigating factors. And we're going to demonstrate as much patience as possible. And we're really going to hope that the federal supply picks up, because as you can see, as you listen to Krista and Mike, there is a plan that when there's vaccine, people can make an appointment and get a vaccine. So we really appreciate your patience. And I just can't reiterate enough how the governor and Commissioner Gifford have been really clear that early childhood educators belong in the frontline essential workers along with other frontline essential workers. And we're really important, and there are other really important workers as well in this pandemic. So it really helps to have this webinar because we can hear from you and we can hear your concern, and we will share that concern with Commissioner Gifford. Right, Krista? You will let her know. I will let the governor know. I have forwarded some emails to the governor from early childhood educators, and he responds within 24 hours every time. You're on their minds, and we're all doing our best, from the governor down to everyone in Connecticut. And unfortunately, we're just going to have to be patient. I'll stop saying that now. It's hard. There's no easy answers here, but the information today was really helpful, Krista. We so appreciate you being here. Rachel, are there any other wrap-ups or questions that have been coming in that you think are essential that we missed in the first round?
I think that we've covered all of the questions, and I just wanted to reiterate that we've published links to many of the places where we're sharing information, description of frontline workers, access to our background check system. We will be posting a link to this recording on our YouTube channel, which is also linked on our website. So we have our website here as just your pathway to find all the information you need to follow up, especially if a colleague could not join today. And we appreciate everyone's flexibility in using this new meeting format, but I think we're all set.
And Rachel, I think what we have to commit to is doing another webinar in several weeks, because things change so much, and you can hear from the chat that this is a really important issue to folks, and particularly, Krista, if VAMS changes, we want to make sure that our background system interfaces with that. But I can't reiterate to you all enough how grateful we are for your service. And please feel free to email me at beth.by@ct.gov if you have particular concerns, and I'll do my best to answer them. I've talked to several providers today, and I'm in awe of what you're doing. So thank you for your service.